Hello, I'm Stephanie Ellis. I'm the Executive Director of Behavioral Health, Crisis Intervention, and Student Safety in Rockingham County Schools, and I'm excited to provide you with some information today about how we meet the social, emotional, and behavioral health needs of our students through Behavioral Health District Integrated Response Teams. This is a structure that can support exploring social emotional needs throughout your district and also behavioral health needs in a multi-tiered system of support. In Rockingham County Schools, this is sort of what we call our lighthouse of hope, and the whole purpose of this really is to look at building a full continuum of mental health services that also include obviously social emotional learning for our students. And so you can see here that at Tier 1, Tier 2, and Tier 3, some of the things that we're working on, but in addition what those foundational practices are. And all of that sort of adds up to that full continuum of mental health supports that we're working to build for our students. So we've used these behavioral health district integrated response teams to try to achieve this goal of building a full continuum of supports for social emotional learning and mental health. When we started thinking about the structure for this, there are so many different models of best practices. You have the whole child model, you have NASP, you have ASCA, you have the National Association of School Nurses, Social Work, Council for Exceptional Children, NAMI, American Public Health Association. This is just to name a few. And each of these models have a best practice of the way their profession moves forward to engage in problem solving for students. And so we started thinking about how are all of these different professions coming together to really problem solve and develop infrastructures for social emotional learning and mental health needs for our students. So when you think about the term behavioral health, we've chosen to use that term in Rockingham County instead of mental health services because it is more all-encompassing, and it really is about emotions, behavior, the biology, self-concept, overall well-being, and the ability for that student to function within their environment. The other term that we often use, that many of you also use, is specialized instructional support personnel. And this personnel is a variety of different backgrounds, such as school psychologist, school counselor, nurse, etc., that provide supports throughout the district. And so those could look like direct counseling supports, social emotional learning groups, consultation, parent education, etc. The other piece is when you think about an integrated response, when you look that up in like Webster's dictionary, it means combining or coordinating separate elements so as to provide harmonious and interrelated whole services. And so I just thought, wow, that really is what we're trying to, that is the vision of what our behavioral health integrated response teams really are. And of course, all of this would need to be aligned with MTSS. So we thought about taking all the models from specialized instructional support personnel and the guidance they bring, along with what we know about good implementation science. And hence there came our Behavioral Health District Integrated Response Team. So this is sort of our logo for behavioral health in Rockingham County, inspiring hope, making a difference, every single one. And really the goals of that team is that we're focused on the whole child. We want to partner together. We're committed to that. We're collaborative. We engage in problem solving. We collectively serve. And we engage the family and the community. All of those goals are really at the heart of what the team does at the district level and at the school level. So why would we do this? Not to mention all the things we just talked about, but also we needed a district integrated response. We wanted to make sure that we were focused on the whole child and looked at that from different perspectives, from different specialized instructional support personnel. And then also we wanted it to be aligned with our multi-tiered system of support efforts. And then also we wanted a multidisciplinary approach and integrated response to meeting the social, emotional, and behavioral health needs of our students. So this really has brought about what I would say system level changes for our district. And so we've worked on really defining what those roles are, and we're still working on that. We've looked at those system level changes and school level changes. and then also social, emotional, and mental health needs and crisis response efforts. So that team really hits these 5 core areas across our district and made impact in all 5 of these areas. We have at the district level a behavioral health leadership team that meets really about every 2 weeks. And the purpose of that team is to meet and coordinate behavioral health services through an integrated district response aligned with multi-tiered system of support. This team is also our feedback loop to our mental health advisory council that oversees that building of that mental health continuum within our district. This is an example of what that behavioral health leadership agenda, that's the district level team that meets every 2 weeks. Of course, there's more details in it. I just wanted to try to fit this on a slide so you can see. But we sort of have the agenda topic, the notes, and then decisions that we make, who is going to do that, and by when. And so the purpose of it is really when we've set up certain trainings in the district, how is that going to run? What's that going to look like? We talk about data consistency and best practice consistency. When we have a training or a professional development that's coming up that's led by our district level behavioral health district integrated response team, what is that going to look like? What topics are we going to cover? But also this is really more aligned with the problem solving process. That is really at the core of MTSS and really just good implementation science. At the district level, we have set up 5 PLCs across our district for all specialized instructional support personnel. And the purpose of this is really to clarify the roles that each of the specialized instructional support personnel serve, but also to be a feedback loop for schools and teams. And then the purpose of that is to help problem solve and remove barriers and really talk about at the district, what do we have at the district level that's our standard response protocol for mental health and social emotional learning within our district? And how can you take that back and set that up within your district? So we do school team training, but also to continue that support, we do these PLCs throughout the year. And then of course there's also an advocacy piece. There's the feedback loop that we provide to our district leadership at our cabinet level and our core leadership at various departments within our district. And then we also have a schedule for training and implementation and communication. And so then also looking at what are the agenda items that we really need to also bring up at our mental health advisory to support schools and district level teams as well. So the district level team really supports the strategic vision of what mental health, building a mental health, full continuum mental health services and social emotional learning looks like in our district. That team provides training, guidance, hosts the district behavioral health PLCs that we talked about, coaching supports, making sure that that team also supports each of the school teams by helping model and also provide support throughout the year. And then also ensuring that our best practice really is aligned with multi-tiered system of support. We have 2 behavioral health contacts that attend each of the PLCs at least. Certainly all of them are invited, but the purpose of that is that we want at least 2 of them to attend. That means that at the PLCs, not only do we have all of the specialized instructional support personnel, but those 2 contacts really have to be there to ensure that there's communication at the district level and to the school teams back and forth. So data reports, things like that are submitted by these 2 contacts. Anytime there's a behavioral health crisis, I work as the crisis intervention coordinator and director in our district, so I'm communicating with them as if there's a suicide or threat assessment that's pretty high, or if there's some other type of response that's needed for crisis support. I'm working with them as well. And so that district level team really has the PLCs where all of specialized instructional support come together to problem solve. But these two contacts really are that feedback loop from the school team up to the district team to ensure there's seamless district communication, and also that the operations are solidified and what we're trying to accomplish here. The other piece that we really have to do at the district level with a behavioral health district integrated response team are there are lots of teams in schools. And while we've tried to definitely in Rockingham County streamline some of our teams and not create more teams, the reality is there are teams within the district. And so we want to make sure that there are feedback loops that are occurring. And so, we definitely want to make sure that all of our leads for specialized instructional support personnel are on the same page. And so those communication loops with our behavioral health district integrated response team occurs, with our district MTSS team and school teams. Collaboration meetings are held with our curriculum instructional support services department and our exceptional children's department. Our mental health advisory, we want to make sure there's information coming out to all of these individuals. Also that there's connection with our student health advisory council, our SHAC team, and that there is information that is shared at administrator meetings and also with our district cabinet and core leadership. So all of those communication and feedback loops are really important as you're problem solving for behavioral health and social emotional learning. At the school team, this is who makes up that team that meets at least once a month. And the purpose of that team really is to talk about social, emotional, and mental health needs. It's a cross-disciplinary model that's aligned with multi-tiered systems of support. And so that is the school counselor, the school psychologist, the behavioral health specialist, mental health specialist, school nurse, sometimes the school resource officer if that's applicable, but not every time necessarily, and then our school social worker. And then also that administration feedback really is required and needed. And then there also are times where we have our exceptional children's teachers who might be a part of this depending on what the needs are for that particular student. An example agenda that we use for our school teams would look like, we have attendance who is actually there, which specialized instructional support is there and present. And then we have our team norms and core values that are established. But in addition to that, always talking about our celebrations. What are we doing right? What are our successes? Starting off and really focusing on that. But then also looking at our Tier 1 behavioral health and social emotional learning supports and discussing how that's going at our school level and what supports we might need to provide in that area or help problem solve within the school level. And then also looking at supplemental Tier 2 supports, social emotional learning groups or groups that may be running within the school and the data that goes along with that. This is certainly a really short modified version of the agenda, but I just wanted you to see what topics we're actually discussing at those school teams. And then Tier 3, behavioral health intensive needs supports, reviewing that progress, really talking about students who are needing that individualized supports, students who are making progress within counseling, or maybe they unfortunately have had an issue where they've had to have a hospitalization and come back, and we've had to talk about re-entry and safety plans and what that needs to look like for students. And then always at the end we talk about what are the communication loops. What do we need to communicate back to our MTSS team at the school level, anything at the district level that we need to send up from the school, or any other group that we need to share or communicate with at the end of that meeting is always discussed. And then the next meeting is set up. And so, like I said, that group meets at least once a month in their school. They can certainly meet more if they have a need, but they have to meet at least once a month. And then what does this look like, sound like in our outcomes? Again, we're meeting monthly. We're including all specialized instructional support personnel. The focus is really collective discussion about problem solving, advising, planning for next steps, discussing outreach, referrals, trends, all that good stuff. Our outcomes, really, what is our collective problem solving at Tier 1, Tier 2, and Tier 3, ongoing communication, trends for social emotional support, and behavioral health needs for academic success. And then also at the district level and school level, when you really look at the whole purpose of this, our priority was to create a unified district level system to guide the work. And then also to align our priorities through professional learning communities and then institute formalized collaboration that needs to occur to make sure that happens. In the past, I would say that was more done through emails, texts, phone calls, just, in informal types of communication, but this really does have a formalized approach to ensure that we really are thinking about every student who might need these supports in our district. The other piece that this Behavioral Health District Integrated Response Team has done at the school level and the district level is really set up systems to support crisis response. And so we do align ourselves in Rockingham County with the NAS Prepare Crisis Model. It's a national crisis curriculum that is built by individuals who've worked in schools for individuals in schools. So it's the only crisis curriculum that really is from a school lens. And so that training really has a way to respond for crisis intervention and response to acute trauma. And so making sure that, all of our specialized instructional support personnel is trained in this model so that we do have a systematic way to respond in the event of a crisis. Also, we've updated our threat and suicide assessment procedures. This is to make sure that all of our specialized instructional support personnel work on that multidisciplinary team together and have a common way of addressing that when that happens within our schools. And then looking at hospitalization reentry plans and making sure that that's a part of those behavioral health teams that are meeting in the schools on a regular basis. And then we've worked really hard to train all of our administrators in this model, but then also all of our specialized instructional support personnel as well. So that's a little bit about behavioral health district integrated response teams and our infrastructure for problem solving about behavioral health and social emotional learning in Rockingham County Schools. If you have any questions, please feel free to contact me at slellis@rock.k12.nc.us. And you can also follow me on Twitter. I'd love to also follow you. And I hope this has been helpful today and you've been able to use this information to support infrastructures in your school aligned with a multi-tiered system of support. Thank you so much.